with the exception of saying that, there's been challenges, as we have recognized even before this, around people who work in various healthcare facilities, particularly our long-term care homes and assisted living facilities. But we know it's a challenging environment for healthcare workers in all settings. And one of the major things that we have done is come up with a plan for healthcare workers in long-term care, assisted living, and acute care to work at one facility, to be focused on one facility only, and try and reduce some of that inter-facility transmission of staff, which can be a way that transmission happens between places. So that's my primary focus right now, is ensuring we're doing everything we can to reduce the chances of outbreaks in all of our facilities in the healthcare sector.
I think I'd say, Marcella, first of all, that people in long-term care are doing extraordinary work, and I think we'd want them all to know that we're with them, and that includes in BC we have about 29,000 publicly funded long-term care beds. About a third of those are health authority owned and operated. The rest are public beds, funded public beds in private and nonprofit care. And I know there's a lot of concerns right now across the system, but I would say this: I think everyone in the sector is working very hard to deliver really good service and really good care and really good supports to the residents of long-term care. And so there'll be lots of questions, and there are lots of questions about changes that we'll need to make in healthcare in the future as a result of this. But right now we're in the midst of it, and I just want everyone to know in long-term care, I know Dr. Henry does as well, is that we're on your side, we're working with you, and we're doing everything we can to support you. I so admire, and I've always admired, the work of care aides in long-term care. I think it's some of the most valuable work that is done by anybody in society. And I think all of us get a sense of this, perhaps when we have someone we know and love in long-term care, we get a sense of that. But the work they do is extraordinary. The work of nurses and others and LPNs in long-term care is extraordinary, and we want to be with them right now and work with them to do our absolute utmost for residents during this period to ensure that workers are safe and that residents are safe. There'll be lots of questions, and we'll be happy if we get to a point when there's a vaccine and we're moving past all these things to address some of those questions. But for the moment, we're doing our absolute best to keep people safe right now and to ensure that people stay healthy in BC amidst this international health emergency.